Ka Khalsa, Waheguru Ji Ki Fateh. Welcome to a special edition of Community Matters, SIKH Channel. I'm very pleased to be joined by a special guest today in view of the new twist to the pandemic, the new turn that events have taken in the worldwide pandemic in recent days across the world, not just here in the UK, but all around the world. The new variant, Omicron, is rapidly increasing and transmitting across the world, as a French president put it, like lightning. I'm very pleased to be joined by Dr. Justin Varney, who is the Director of Public Health here in the centre of England in Birmingham. Justin, it's great to see you. Thank you for joining us on SIKH Channel.
Good to see you and thank you for having me.
The last time we met, Justin, was here in the SIKH Channel studio in March 2020, when you came to a specially convened meeting to help the Sikh community, to help all the communities deal with COVID. And I remember we had a gathering here, socially distanced and with all the precautions possible. But even so, I caught COVID from that meeting, and I suffered terribly. In March 2020, for about 2 weeks, I was incapacitated and had quite a terrible time. And this was when COVID was very new, and we didn't know what it was. And my family and friends were very worried. Unfortunately, thanks to Waheguru, I was fine and I'm healthy and I'm absolutely 100% again. But now matters have moved on. Justin, where are we with COVID and the pandemic now? There's been a few different variants.
So what we're seeing now is a new variant of the COVID virus, which is the Omicron variant. The variants happen because as the virus reproduces itself, it makes mistakes, but sometimes it means that the virus becomes more dangerous and more infectious. And in this case, the Omicron variant is much more infectious than the previous Delta variant. So we're seeing more people catch the virus and more people potentially become sick and die. There is no evidence yet that the Omicron variant is any milder than the Delta variant. We're still looking at that and we're still learning because it is still a very new version of the COVID virus. The good news is that all the things that we do to stop the spread of the virus, wearing a face covering, washing our hands, ventilating spaces, opening windows before people come to it, all of those things reduce the spread of the virus.
Upon what you've just said about the severity of Omicron, we have had very clear reports from South African doctors that they say it's less severe. There's also been supported by data from South Africa. The hospitalizations are markedly reduced and the severity is reduced. So I think there is a lot of evidence there that it's not as serious.
So it's really important to look at that data in the context of it. So the average age in South Africa is 10 years less than it is in the UK. So they are a much, much younger population. And we are still watching that data to be able to make a judgment. So we know that in general, if you're younger, COVID is less serious, which is good news. Although it's really important to remember that just because you're young doesn't mean you can't develop long COVID. And we are seeing people 12 months after they had COVID the first time, still having symptoms and still having problems, who are in their 20s and 30s. Now, the evidence in the UK so far, predominantly from London, where there is more Omicron than anywhere else, is that 9 out of 10 people in hospital are unvaccinated, and that people in hospital are still getting sick, requiring oxygen. Now, it is still too early to know whether they're going to die or not, because in general, it's when you catch COVID, it's about 2 to 3 weeks before you're sick enough to end up in hospital, and then another 2 to 3 weeks before you die. And that's the kind of pattern we've seen with COVID in general. From catching it to dying can be anything from 6 to 12 weeks. So it's still very early days. And the World Health Organization has been very clear, looking at the data from South Africa, because it is a small sample of data, predominantly from very young adults, it is too early to be able to say that this version of the virus is any less serious. The other thing we are seeing is that the vaccine does protect people against Omicron, but you need the booster to get your antibodies levels up so that if you get infected, it's kept under control. And in London, we're very clearly seeing people who are not vaccinated are in trouble now with Omicron. It may well be that over time we see that if you're vaccinated, Omicron is very mild. But if you're unvaccinated, it's just as serious. So that's why there's such a big push on the vaccine effort at the moment.
And is it fair to say that Delta was perhaps a more serious variant than Omicron?
At the moment, we can't say that. Delta was certainly, people who had Delta seem to have more symptoms and more severe symptoms. Omicron, it's just too early to tell. And we're not necessarily comparing like with like. The vast majority of the population now in the UK have at least got 1 or 2 doses of vaccine on board. We didn't have that when Delta came. So what we're seeing is that if you've got the vaccine, even if it's the same level of severity, Omicron and Delta, the vaccine makes it less severe. And so that's where it's difficult to say, is one worse than the other? Because the difference now is that more of us are vaccinated, and therefore that we know that reduces the symptoms and reduces the severity. And that's why there is this big push on vaccination, because more and more we're seeing the vaccine really is saving lives.
So it may be that Delta was more serious, caused more serious symptoms, and there's now better vaccination. So do we need to panic? Why is there such a big panic and a lot of fuss being made of Omicron? Do we just need to get on with it?
I think it's really important people take this seriously. So Omicron doubles its infection in 2 days. So if you have 100 people with Delta today, in 2 days, you'll have about 110 people. If you have 100 people with Omicron today, in 2 days, you'll have 200, and in 4 days, you'll have 400, and then you'll have 800, etc. And if you've got 10 on day 1, you've got 20 on day 2, and then it goes up much, much faster than it would with Delta. So if it's the same severity as Delta, because it is so much more infectious, more people will end up in hospital. If it is slightly less dangerous than Delta, you will still end up with more people in hospital because more people will catch Omicron in the same amount of time. So the pressure on the NHS is still going to be a lot bigger. For Omicron to be something we didn't need to worry about, it would need to be virtually harmless. And that is not what the South African data is saying. So people are still ending up in hospital in South Africa. They're still requiring oxygen. And although it looks like that might be a lower proportion, so rather than 10 in 100, it might be 6 or 7 in 100. Because Omicron is so much more infectious, something we didn't know about, that would need to be 100. Many more people catch it. The other reason that we are really worried is that because more of us are catching it, and we've got to stay at home for 10 days once we've caught it, we can't go to work. And that affects doctors and nurses just as much as it affects postmen and people working in restaurants. So there are 2 things going on. The health service is facing potentially a lot more patients, but it's also struggling with a lot more staff being off sick. And it's that double whammy, that 2 effects of Omicron, which make it a much more dangerous situation than Delta, which was less infectious, but still serious.
But is the Omicron in some ways, in a strange way, a blessing? Is it going to help humanity in the way that President Putin described it as the antiviral virus. If a lot of people do get it and it's so transmissible and it goes across the world, will that create a natural antibody for everybody and act as a vaccine for the whole world?
So it depends a lot on how long natural immunity after Omicron lasts. And the reason I say that is because we know coronavirus is a virus that's part of a family of viruses that include the common cold. And the common cold is very mild. The problem with the common cold is that because it's so mild, our body doesn't learn to defend itself. So we keep catching colds. So we don't know that if Omicron proves to be less aggressive, will our body remember to defend itself against reinfection? We know from Delta and from Alpha, the previous versions of COVID, that natural immunity runs out after about 6 to 9 months. Now, the question is, if the virus is getting less dangerous, do we still get 6 to 9 months protection? In which case, the combination of the vaccine and lots of people getting Omicron and getting natural protection will probably smooth things out, and we'll get a lot calmer, a lot lower numbers over the summer. If that doesn't happen across the whole world at the same time, then we end up what happens with flu, that say in the northern hemisphere, we've all had Omicron, vaccinated a number low, but in the southern hemisphere, vaccination levels are still quite low, and Omicron basically can still run around, and it basically hides down in Australia and then comes back 6 months later when our natural immunity is worn off. So it's a big gamble to say, oh, this is fine, don't worry about it. And I don't think it's acceptable for us to sacrifice the number of people that would die if we just let this rip. So it's really important people do get the vaccine. We are hopeful that with the vaccine, natural immunity with a virus that's very infectious, and the boosters, that we might see this off by Easter. But it's a big might. And, I think a country that says you don't need to worry about this and let it run wild is really going to sacrifice a lot of people's lives to buy that. And I don't think that's something that we should be doing.
Dr. Varney, would you like to see a full lockdown in the United Kingdom?
I think if we increase nation coverage, particularly in our 20 to 40-year-olds, everyone goes and gets the jab. If we keep up with testing and we all act responsibly when it comes to having friends over, ventilating rooms, letting the air in, washing our hands, wearing our face coverings on public transport, then with the aid of the vaccine, we should be able to navigate this without locking everything down. Be enough people vaccine, then the government will have to instigate tighter restrictions, because those people will, even with a potentially milder virus, possible, and that will overwhelm the NHS. So I think it's a very, very tight race between everyone getting the jab as possible and the government making a judgment call about whether the NHS will make it through January. Because we've got to remember, if the NHS is overwhelmed through sickness absence and through people coming in the door with COVID, what happens is not just people die of COVID, people die of heart attacks, of stroke, of cancer, because when they really need the NHS and the health service, they can't get a bed, they can't get the support they need. So, the main message is please go get your vaccine. That is the best chance of us staying out of lockdown at the moment.
We've seen examples of civil unrest across parts of Europe, especially on the continent, in Denmark and other countries. People are getting fed up and they're taking to the streets and there's violence. Thankfully, we haven't seen much of that here in the UK, but people have had enough and they want their freedom back. And there are some people who are particularly vulnerable and at risk. Is it a time now to shift responsibility from the government to issuing directives about the pandemic to individuals making their decision whether they want to isolate and so on, and to go into a sort of a self-induced lockdown, and other people to carry on as they wish. Do we need to get this balance right?
I think it is a balancing act, and I think at the moment that's one we're treading. The advice is these are the things you and I do when we're out the front door, and there's relatively little that the government has said you must do. However, we've got to keep in mind there are a small number of people who cannot, because of their health, they cannot be given the vaccine, can't be protected. And it's a question about, as a society, do we believe we have the right to go out and be infectious and spread that about when there might be someone in the shop next to me who, because of their health circumstances, cannot have the vaccine, cannot be protected. And because I'm refusing to wear a mask because of my ideological position, that I'm putting them at risk. And is that okay? And I'm not sure it is. I think, this is a bit like wearing a seatbelt. We wear a seatbelt to protect ourselves, but also to protect other people when we're driving. It's about being responsible and being part of society. And I know, particularly for your listeners within the Sikh faith, this is something that's really important to all of you, about taking responsibility for society and for the good of the world, and acting responsibly as we pass through life so that we leave the world a better place than when we came into it. So I hope that the vast majority of us act responsibly. The research and the evidence says that it's a very small proportion of the population who are truly anti-vaccine and anti-restrictions, and that the vast majority of us kind of go, it is not that much hassle to wear a face mask. It was not that much to wash our hands and to use hand sanitizer when we go into a shop, when we come out. And out rooms before people come to visit is not that big a request of people. So, I think for the majority of people, these are perfectly reasonable things that we can each do every day without having to see a law brought in to force us to do them. I think, things, unfortunately, it's a loud and vocal minority who sometimes upset the apple cart for everyone. But I hope that for many of your viewers, this is just common sense. This is how I protect myself and the people I care about. And whether the government tells me to do it or not is somewhat irrelevant. We've lived years, too many people have died for us to just chuck it all away at this stage. I think we are in the last straight. I think if we can get through this spring, then we will have a much, much better summer. But it is up to what we each do every day.
And we will look back and look forward. Before we look back, I want to look forward and ask you to look into your crystal ball. We won't hold you to your prediction or your analysis, but where do you think we will be just in say, next winter, in 12 months' time, because the winter's when this pandemic likes to strike. Where will we be? Will this be over? Will it largely all be over?
I hope so. I think what we will have, February will be very, very difficult, particularly for health and social care, but also for businesses. I think the level of sickness absence is going to make it very hard. I think we will then have a relatively relaxed late spring and summer. Coming into the autumn, the big question will be, is there any new variants? If there are, then we may well need a booster dose for everyone, to a bit like flu. We have an annual flu jab, not because our body forgets how to protect itself against flu, but because the flu virus every year changes its coat so much that we don't recognize it. Suspect that we probably have got 1 or 2 years of an annual COVID booster, a bit alongside the flu jab. But by that stage, by the end of everyone will be boosted and protected to the point that we can carry on with society as normal next Christmas. But everyone will need an annual booster because the COVID virus will keep trying to change so it can keep on surviving. And it will probably do that for 2 or 3 years, and then we'll be out of it for good, and it will be something in the history books.
That's great, Justin. We've got that quote from you recorded as normal next Christmas. and we'll review that in a year's time or so. No, just looking backwards to last Christmas, where were you? Were you in a party with your colleagues in the council house?
No, I wasn't. I think I was actually last Christmas. I would have been in my sitting room before I dismantled the spare bed to create a study at home, and I was approaching a bubble for Christmas Day with my parents. I think last Christmas I talked about that where we would be heading and the risk of variants. I had hoped we would get through the winter without a variant, because I think everyone is tired. We want some time off COVID, but unfortunately, COVID doesn't work like that, and it's not giving us time off, and we are going to have to keep going. But I think the reality is that we probably have another 6 months or so of hard slog, and then things will get a lot easier. And my hope is that that's a Christmas prediction that will come true. Last year, I was predicting we had at least another year, so I wasn't far off. This time, I would say another 3 to 6 months, and I hope things will be a lot easier. And so we'll be able to enjoy the Commonwealth Games without having COVID hanging over us.
It's tremendous. Dr. Varney, thank you very much. We've lived through history. The past year and a half, 2 years, we've been living through history, and this pandemic will be recorded in the history books. How's the pandemic permanently shaped or changed you as a person? What has it personally done to you?
I think it's probably made me reflect more about the amount of compassion we need in society. I think I've been very humbled by the people I've met who've gone way above and beyond whatever their job title says, or the amount that people have put into communities, the generosity of our faith leaders who've sat with me virtually since before the first lockdown, and have patiently talked me through the different religions, different practices, so we can come up with COVID safe guidelines to work within gurdwaras, within our masjids, within our temples and our churches. I think it has taught me a lot about running a marathon and rather than a sprint. And as a doctor, I'm very used to, and I was trained into people having heart attacks or people being road traffic accidents, and how to manage myself during that acute short-term emergency. I think managing yourself through 2 years of a pandemic in this role is a very, very different scenario. And like everyone else, I've had ups and downs and moments of wobbling, of self-doubting. But I am stronger for the experience, and I think we are stronger for the experience. And I hope that the legacy of this is that we continue to work together and we continue to be a city which comes together for the better outcomes for all of us. And that for me is the bit that sounds awfully hardish, but it is the bit that I feel so pleased about, that as a city, people have set aside old rivalries, politics, disagreements, and just gone, what is the right thing to do to save lives? And that's why we've weathered this storm as well as we have. Unfortunately, the storm has still got a bit to give us, but I hope we'll weather this last bit together well.
It's tremendous. Thank you very much, Justin. I want to wish you well and the season's greetings. I do hope you'll find time to rest, a very well-deserved rest. You've been serving the communities extremely well for over a year during this pandemic. You've been very helpful to us here at the SIKH Channel, so please do find some time for yourself. Thank you very much for joining SIKH Channel Community Matters and sharing your thoughts and helping our viewers to understand the pandemic and its course that it's likely to take. Please do keep in touch, and we hope to see you. Perhaps we'll be celebrating the end of the pandemic in the coming months and years. Thank you very much. Thank you.
I look forward to it.
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ